Good afternoon. So, my name is Jennifer Cabe, and part of what I had planned to say has already been said much more articulately than I could ever dream to do. So I may be sort of going through some slides and saying, well, we already heard about this from somebody else. But I'm going to take 1 minute from my 20 minutes and just reflect on a sort of a personal level. I'm really deeply honored to be asked to be here. I want to thank the committee for the invitation, and in particular honored to be on a panel with the person who introduced me to health literacy. When I worked in the Office of the Surgeon General at the U.S. Department of Health and Human Services was Alice Horowitz. And together with Cynthia Bauer, they were the ones who spoke with me, and I was then the speechwriter to then Surgeon General Richard Carmona about health literacy. So I was reflecting with Alice a little bit earlier today. It's sort of hero worship. I'm a little even afraid to go up to her and thank her for what she's done for the field. And then it was then through that experience that Cynthia and Alice were, of course, the wise ones who said, you want to know about health literacy, you bring in Dr. Rima Rudd from Harvard. And so we began. And today, I now have the great pleasure and privilege to get to continue to learn day by day and sometimes hour by hour from my colleague, Andrew Pleasant. So I want to thank him for including me in the development of the commission paper that he spoke about earlier today. So this topic of health literacy and the reality that we're all aware of, several of the speakers this morning mentioned that the case has been made that lower health literacy, whether it's causal or correlative, results in lower health outcomes, poorer health outcomes. So this is something we know. And this isn't just anecdotal, of course. Rima said this so beautifully earlier today. It's sort of as if, the science is there, the debate is over. Lower health literacy leads to poorer individual health. We know this from multitudes of studies. So I naively thought, well, I'm going to look through the literature and find where somebody has proven the opposite, that proficiency in health literacy is a protective factor against chronic disease. And I couldn't do that. I really thought that was going to be, something very simple to look up. Somebody else has already spoken about this, but what the heck, I might as well make the point. So I couldn't find it. And then I started asking myself, well, gosh, why do I think that's so important? And that's when I started to be able to just flow with this question. It matters because of the increasingly complex healthcare system that's becoming all the more complex and all the more trying, I would say, and frustrating to individuals and families and communities. Hopefully it's going to get better, but right now we're in a little bit of a challenging place, as has been pointed out in the past few hours today. And then we look at the financial and social costs of treating chronic diseases, many of which, as we know, are completely preventable. The financial costs are large and mounting. I can remember when we talked about the fact that nearly 14% of GDP was spent on treating chronic diseases, and now we're saying it's at least 18 or 19%. This is unsustainable that it keeps going up, and we all know this. We also look at the fact that of every dollar spent in healthcare, 75 cents of every dollar is spent on treating chronic disease, and that just keeps going up. I've heard researchers whom I have no reason to doubt updating that CDC data to say that it's now climbing up to closer to 80 cents of every dollar. So then we also ask people to do so much to take care of themselves, either in preventing chronic disease or self-treatment of chronic disease, the self-care plans, needing to follow extremely complex medication regimens that are fraught with possibility and opportunity for safety problems, as somebody pointed out beautifully already today. So continuing, why does it matter? This is looking at all of the really heartfelt and good work that so many people are doing across our nation to help people sign up for health insurance. All of these steps that you see up here on the screen, all of this stuff needs to happen. All of these complex interactions need to occur before somebody even goes into a healthcare setting, an individual healthcare delivery setting. And that affects each of us when we look at the big picture of public health, and affects, of course, the costs. So here we are again also on the costs. And this is something that we've also known for quite a while. So here we are sort of repeating what we know and saying it to each other. And it really reminds me also of something that Rima said earlier, that this is the time for action, and it cries out right now for action, and in particular in partnership. And that's something that I am planning to touch on a little bit today, and the importance of that. So all of these musings about can health literacy be a protective factor in chronic disease, prevention of chronic disease, really got me thinking, well, if we don't have literature that talks about that, do we perhaps have literature that says at the very core of it, the hard core of it, is lower health literacy the root cause of chronic disease? So as we're talking about the great possibilities and savings from both a human perspective and an economic perspective of prevention of chronic disease, what's the absolute opposite? And this is a study that Andrew pointed out to me. And the thing that really, really gets me time and again, every time I reread this or look at this slide, is that none of the other factors mattered. It was all about low health literacy in what caused the higher mortality rates, being sicker and dying earlier. So, does it then follow, if we look at all of what we already know, that we can once and for all take the idea that health literacy is purely about that clinical interaction? We all sit around here and we can say to each other and to ourselves, well, of course it can. That's what health is truly about. When we look at what even people consider to be health, and we know that 95% of what we spend money on is health care, is in the clinical aspect, and 5% of what we spend money and time and energy and our resources on is what people think of as health. So that's what I mean by public health, population health, wellness, being able to take care of yourself, being able to take care of what you want to do in your life, your family, your work. That's where, when we're getting into talking about prevention of chronic disease, and that is then we get to the systems level, because as much as we know about chronic disease prevention, we know where the gaps are as well. Not only what is working, but we do have these big, huge gaps. And you look at what's missing, and it just keeps coming back to what we've been talking about today in health literacy. And what if you do just as Linda was explaining, if you do follow those 7 steps, I love those 7 steps, you are going to, they're intensive, they're expensive, but then you're going to come out with an intervention that is going to save lives and save money. So what do you get with those 7 steps in that health literacy approach? You get the involved and engaged users, you have messages that they can understand, and you get the sustainability aspect. You get what really helps people get to behavior change, and that's trust and mutual respect. You don't get at trust and mutual respect if you see people as crowds, if you see people merely as dots on a chart. And you do get there if you're really being willing to take a look at, sure, it is public health, it is population health. We're talking about groups. People talk about populations, but populations are made up of people, and no individual has made a change in their behavior based on what's going on with out looking at all the aspects of knowledge and attitude and their beliefs and their behaviors. These are the targets that we have to work with. These are really it in public health. When we're talking about health literacy, it's behaviors. And literacy, good news is, and here I'm looking at Cece Doak, knowing that she and Mr. Doak taught us early that literacies are behaviors. So what do we mean by that? We mean that it takes somebody making a change in their behavior, in what they can learn, how they can understand information, how they are evaluating it in the context of their life, communicating it, and then using it. And that all takes you back to fundamental literacy as well as the other key domains of literacy. So is it literacy, however, just in literacy for literacy's sake? Is it literacy just in a health context? And this is to me one of the most interesting aspects of when we talk about health literacy and public health, because if you look at literacy and you say if somebody has high literacy, they're great at reading and writing and math and oral communication when it comes to health. Does that mean that they are going to have good health outcomes, that they're going to be a healthy person, a healthy family, a healthy community, a healthy nation? Or is it more than that? I think we would all agree that we know people who have low literacy and excellent health behaviors. We also probably know people who have high health literacy and poor health behaviors. The classic example there is, of course, healthcare professionals who drink too much, don't manage their stress, smoke cigarettes, or any of the other behaviors. So this then takes us to what Rima mentioned earlier of partnerships. The partnerships of working with the people whom you're actually wanting to have an effect with. That's the health literacy golden rule. Start with people early and often. The integrative approach to public health, including their whole lives, but also including from the side of the public health agency or practitioner, the team approach to public health, which is part of the integrative approach. That is how you then get to the concept of we can actually prevent chronic disease. So when we talk about, as Rima said earlier, we can't afford to sit back and wait for the educational sector. We can step in with this intervention and talking in particular about health literacy. This is a story that I wanted to share because, at least for me, all the ideas are great that we're hearing and all the data is great that we're hearing, but when it really comes down to it, it's about one person at a time making up public health or making up a population. Dean Rutland was somebody who lives in Cleveland. This is a testimonial from her, shared, with permission. She says, I was feeling bad emotionally and spiritually. I needed to do something, so I called to sign up for this program where Andrew and I work, the Canyon Ranch Institute, offers in communities around the country, including Cleveland. I went in for my assessment, so this is Dean talking again, and I got a real shock. I couldn't do a single sit-up. I couldn't do jumping jacks or walk for 5 minutes on the treadmill. And then I got the news that I had high blood pressure. It was so high that they told me to go see my doctor immediately. I managed to hold my tears inside until I got out of the room, but I began to sob as the elevator doors closed. I was overwhelmed with the reality of what poor health I was in, and I was scared. At that point, I had no intention of going ahead with the program, but Teresa Brown, The exercise specialist who had done my initial assessment called me at home. She talked to me about putting my embarrassment aside and taking the first step. She also assured me that I would meet others in the group who needed to make changes. She was right. Before long, I'd made new friends. We'd even meet outside the sessions to walk together. I could tell I was on the right track. One of the hardest things I had to do was take the blood pressure medication my doctor prescribed. I didn't know how to take it, and I was afraid of it. I had a real aha moment when my doctor told me my blood pressure had actually gone down. But it was only because somebody sat down with me and explained to me how to take the medicine that I even knew what to do. My doctor told me then that with continued progress, I might not even ever need the medication. I knew I didn't want to take pills for the rest of my life, so it made me feel awesome to know I had done something so positive. What I learned in the program helped me to change what I ate and motivated me to move every day. I completely restocked the food cabinet at home. My 5 children are encouraged to eat better, and my daughter in North Carolina even walks with me. We use our phones to connect by voice and picture, and then we talk while we walk together. I've lost 40 pounds, and I finished my first 5K race. So this is Dean crossing the finish line at a 5K race. She says, when I crossed that finish line, I wanted to keep on going, so now I'm training for a full marathon. I have to give a lot of credit to the Life Enhancement Program and the core team members who supported me even after the program ended, my family and the friends I've made. Yes, I give myself some credit too, because making changes took some courage. What I want others to know is that once you take that first step, you can't believe what you can accomplish. So Dean now goes to churches all around Cleveland and talks about what she experienced. Because she became more health literate, fully health literate, she's now helping other people to experience what she has changed in preventing, and not only from a primary prevention, but secondary prevention of chronic disease. So this is I think a great example. Dean's story is a great example to tell us that health literacy really can guide public health efforts and those of us working in public health about where, when, why, and how to invest in chronic disease prevention. And that's a point that's been made already so beautifully today. Chloe made it absolutely crystal clear to us in looking at the maps and saying we've got to see where the greatest needs are and address those needs. But health literacy is a tool that we can use in addressing chronic disease in particular. So conclusions and recommendations. I feel like a broken record. Everybody has said this before. Health literacy is neglected, or it's hidden away in public health efforts to address the health of communities, and this is absolutely holding true, sadly, unfortunately, in prevention of chronic disease. So what's needed? This list, which clearly I don't need to read to you, and it's incomplete, I know, it is what we've already heard today for the most part. And the good news is that the earlier points that I was trying to make about the social, family, community, and economic costs of chronic disease absolutely can be addressed through these approaches. So thank you very, very much.